After a brain injury, you can look entirely normal and still struggle a great deal. I have a patient who put her head through a windshield. She lost consciousness and she was in the hospital for a few days. But then she was able to walk and she went home. She looked normal. She didn't have any physical injuries. She could walk and she could talk. And when people asked how she was able to smile nicely and say fine. But she wasn't so fine. Before her injury, she was an administrative assistant and she was the best. Her boss loved her. She was always on time. She was highly responsible, super organized. She was calm in stressful situations and always followed through with what she said she would do. After the injury, things did not go so well. She looked normal, but if somebody asked her to do something, often she didn't remember it, especially if it was 2 or 3 things. She could never remember several things. She certainly couldn't multitask. She forgot her boss's name. She was late to work. It was very different than what she was before the injury, but she looked entirely normal. Her brain was in chaos, and she was exhausted by 10 a.m. Finally, she lost her job. Before the injury, at home, she was a great cook. She was able to plan trips, plan anything. But after the injury, she could no longer cook. She couldn't remember to turn off the stove, and often she couldn't remember to turn on the stove. She certainly could not plan a trip. She would get frustrated, angry, embarrassed. Her family would get angry with her. And remember, she looked entirely normal. People didn't understand that her brain didn't work like it worked before. They thought she was lazy, and this was super frustrating. So remember, after a brain injury, somebody could look entirely normal. They may be able to walk, they may be able to talk, they may be able to smile and greet you very nicely, but their brain might be in chaos. So try to be understanding, try to keep things simple, and try to work with the person with the brain injury to slowly improve.